Hello, good afternoon. My name is Jora and I'll be your student nurse today. I will be assessing my patient's skin, hair, and nails. That way I could see if there's any abnormalities present in those areas, if there's any lesions, breakouts, bumps, lumps that I could see from the patient, if there's any abnormalities, anything that could associate to an underlying condition or a disease. That way we could see if there's anything that the doctor can do for her treatment and cure any of the possibilities of a disease. So here is my patient. I would like to verify the information with her. Hi, my name is Jara and I'll be your student nurse today. I would just like to verify some information with you. May I please know your full name?
Josie Padilla,
What's your age
39,
and date of birth?
February 3, 1982.
All right. So I would just like to verify this from your arm wristband. Okay, Jazzy person. Okay, thank you so much. So I will be explaining to you what we're doing for you today because the doctor recommended that I will be doing an assessment on your skin, your hair, and your nails. Okay, is that okay with you?
Yes.
Okay, so I will be probably touching some parts of your body and see, I'm gonna be inspecting everything, palpating, and if you feel any uncomfortable or any discomfort, please let me know, okay?
Okay.
All right, so before I do that, I will give you this gown so that you can change, and I will give you some privacy by closing the windows and the door, and I will be coming back for you in a few minutes, okay?
Okay.
Thank you. All right, 5 minutes have passed. All right, hi, Miss Jazzy. Are you ready for me today?
Yes.
Okay, good. So I would like to adjust all the lighting and the temperature in the room. That way my patient is comfortable. So first of all, I would like to do my hand washing technique. I'm going to lather everything to cover most of, like all of my hand. And that way any microorganism will be gone, and then I will be getting my gloves, a pair of gloves, so that I could assess my patient, um, and I don't cross contaminate my patient with any microorganisms. So first I would like to see your skin color. All right, everything looks good, everything looks even, and also your feet. Let me see. All right, very good. Okay, so looks like your skin is soft and moist, and it doesn't look like it's dry, and looks like it's even all over your body. Um, I would just like to see if there's mobility and also turgor, and looks like it's elastic, and see if there's any turgor. Looks like it's going back to its position, so that's very good sign. And I would like to check on any of your nails. Your nails looks squarish. They appear pinkish, and looks like it's conforming to your body skin color. All right, looks good. It's round. There's no any signs of infection, because sometimes if the patient is nail biting, there's a possibility that they might have some form of infection going on their um, fingers and nails. All right, so let me just check everything here for you. Looks everything is looking good. All right. Okay, so her skin looks good. You would like to check with the patient if there's any history of present illnesses. So Miss Jazzy, do you have any skin problems that you're experiencing or you have experienced in the past, like rashes, allergies, any lesions that you are a little bit concerned of? And please describe it.
I just have something in my scalp.
Mm-hmm.
I think they're eczema.
Mm-hmm.
so I'm not sure.
Okay, so let me just check on her head to see if there's anything going on. Okay, her head looks round and it is even and symmetrical with her body. It doesn't look like it's big. And she was saying some um, eczema going on in her scalp. Let me just check on that one. So, all right. Yeah, it looks like there's some kind of a breakout on your skin right here. Very dry looking. All right. So when did you notice that problem?
2 weeks ago?
Okay, 2 weeks ago. So sometimes it may have been a cause of any allergy or any reaction that flared up her eczema. She may have maybe a history of skin conditions in the past. You can ask the patient. So, is there any skin condition that you know from your family?
Yes, my dad has it.
Okay, so that could also relate to any family history. So you could chart that in your chart and document that findings for her. And then, all right, so let me see. So are you experiencing any, like tingling sensation or any itchiness or any numbing sensation on your body?
No.
Okay, so that's good. If there's any findings like that, it could also be related to diabetes or any paresthesia, or if there's some numbing present from the patient's body, like fingers. Sometimes they could feel those, and if it's diabetes, it could be related if they're having some numbness on their feet. So you want to document those data. And do you have any moles present in your body as well?
I have it on my face.
Okay. Do you feel like those moles are growing, or are they just the same shape even before?
They're the same shape since I was born.
Okay, so you didn't notice that it have enlarged, or
No.
you feel like they're having any symptoms?
No.
Okay, very good. So sometimes the moles could also be a symptom of a skin cancer. So you want to check if there's any abnormalities with their moles that they've detected. Maybe their moles got bigger or they became a little bit bumpy. So you want to check with the patient if they've observed any form of like that. And you also want to inspect those moles for them. Let me see if it's more than if it's less than 6 millimeters, then it's good. Sometimes if it's more than 6 millimeters, there may be some abnormal findings on that one. So now I would like to just check if there's any discoloration on your toenails. All right. Okay. They look squarish and doesn't seem like there's something going on. Just a little bit dry on that area. So you would like to check on the patient if they're using any um, skin protector, if they're using some lotions. So are you using some lotions to moisturize your skin?
Yes.
Okay, that's good. Do you use any sunscreen just in case you're going out in the sun when you're swimming or outdoors?
Yes.
All right, that's good because sunscreen is very good protection from the UV rays. So if the patient doesn't use any of those products, it can also be a risk of skin cancer. So you want to take note of that if they're not using some sunscreen. And let me see. Um, did you have any so I would like to see if there's any history of hospitalization in the past or any surgery in the past?
No.
All right. So if the patient have any surgeries in the past, they may also have a risk of methicillin resistant Staphylococcus aureus, which is the MRSA in short. It's a hospital acquired infection that the patient can be a risk of that if they've been hospitalized recently or in the past. So you want to check on that one too. And then, so I just want to check if in the past when you were a kid, did you have any sunburns? Just so we could see if you're predisposed with any skin cancer, if you're always having this sunburns when you were a little kid while growing up as well.
No, not always. Probably just once every year when we go to the beach.
Okay, that's good. All right, and are you taking any medications or ointments? Let's say if you have any itchiness in your skin in the past, like,
Yes, hydrocortisone.
okay, does it work for you?
Yes.
Okay. So some patients they could just get some over-the-counter drugs and they could use that for relief when there's some itchiness in their skin or anything like that. But for my patient here or her, one of her concern is just the eczema on her scalp. But other than that, her skin appears really smooth and even. Doesn't look like there's any bumps or lumps on the skin and any breakout. I don't see anything like that. And then her hair doesn't look like she has any baldness. I've inspected this one. Let me see again. Doesn't seem to have any patches on the scalp, which may be a sign of alopecia or any, and you can also ask if the patient is undergoing some treatment. Let's just say anything. If you see that there's some hair falling, it could be a sign that some patients are undergoing some chemotherapy or any like cancer treatments. And let me just check again your nails. Looks like they are all nice and pink and doesn't look like anything's present because sometimes the color of the nails could present something that's going on, maybe a bacterial infection, or if it's yellowish, it could be a sign of a fungal infection. So you would like to take note if there's something like that from the patient. All right. So I would just like to check with you if you're doing some self-examination from your skin, like regularly. If you're checking if there's anything that's present, or do you have any history that you're getting some form of bumps or anything breakout from your skin, acne, something like that.
No, I don't regularly check. I just feel it if I have a rash, and that's basically it.
Okay. So looks like the patient, if sometimes the patient doesn't feel any symptoms, they wouldn't really like check their skin. But if let's say the patient is a female patient and maybe they're pregnant, you can ask if they are pregnant or if their menstrual cycle is regular. Sometimes those symptoms like acne or some irregularities on the skin may be presenting from the hormonal imbalance that they have. All right, so looks like that I've assessed most of the questions from my chart, and I would just like to check with you if there's any other concerns related to your skin, your hair, or your nails.
No.
Okay, so if that's the case, you could document all the data that you've collected and see if if there's any abnormalities present, which in her case, just that the symptoms that she's presenting, which is eczema at her head, at her scalp. So you want to go to the doctor and tell them the findings, and they would create a treatment plan for her. So after that, so if there's anything that you have a question with, please let me know. Otherwise, everything is done. We'll just give you a call if there's any findings based from my assessment, okay?
Okay.
All right, thank you so much for your time.
Thank you.
All right, so I'm gonna be doing my hand hygiene technique, and then I will be giving all my findings to the doctor. Thank you.